Now to the latest COVID numbers for you in California. The test positivity rate, there you see it at 2.7%. The daily average is more than 3,200 cases. 950 people are hospitalized with COVID in our state. 112 are in the ICU. The daily average of deaths stands at 15. And we're getting answers on where California stands in the fight against COVID.
Yeah, we want to get an update on this. Infectious disease expert Dr. Dean Blumberg from UC Davis Health is joining us now. So first of all, based on the case numbers that you're seeing, how is the BA.2 Omicron subvariant spreading and impacting California right now compared to the rest of the country?
Yeah, so BA.2 accounts for about 97% of the circulating strains now. It's more infectious, more transmissible, and that's why we had that spike in January. But at this point, most people have already been exposed one way or another. They've either been immunized or they've been infected, and so there's at least partial immunity. So even though there's a lot of transmission within the community, almost all these cases are outpatient, and they're not resulting in high demand for inpatient beds or intensive care unit admissions.
So let's talk masks, Doc. The DOJ appealing the judge's ruling ending the public transportation mask mandate. Do you think people should still be masking up on planes, trains, and buses?
Yeah, I'm recommending it. You know, you're on a plane, you can't social distance from your neighbors. You don't know if they've been vaccinated or not. You don't know what their risk behaviors are. And you could be in contact with them for a prolonged period of time. So it just makes sense to me to wear a high quality mask, like an N95 mask, for the duration of that flight until you can get out of the plane and then social distance.
You mentioned earlier just how many people have now been exposed to the virus, and the latest findings from the CDC show more than half of all Americans and 3/4 of kids have now been infected with COVID. So are you worried that there are too many people who are just saying, okay, whatever, and they're letting their guard down now?
Yeah, I'm sure you're right. I'm sure that's what's happening, but it's important to know that even if people have a mild case of COVID, there are consequences to that. In addition to possible transmission to your loved ones who might have more severe disease, there's also the danger of long COVID, which can really impact people's lives. For students, for kids, it interferes with their learning and their school and their social interactions. And for adults, it can cause them to miss work. So it can really have an impact, a deep impact on people's lives.
Going to ask you to break out the crystal ball right now and take a peek around the corner. How concerned are you about a fall or winter COVID surge?
I'm hopeful that what we have is very low rates of transmission during the summer, and that we do start seeing an increase in the winter. Not that I want an increase, but that would be the usual season that we would see an increase due to the temperature and the humidity. And then we'll hope that it's not too big of an increase, but it should turn into a seasonal respiratory virus similar to influenza. We should see an increase in the fall and winter. The question is how much, and if there's going to be a new variant in the meantime.
All right, Doc, as always, thanks for your time. Appreciate the insight. Dr. Dean Blumberg, thanks so much for joining us this afternoon here at 4.